Okay, so thank you, Neil Bergsman, for being here today to share with us about ARPA, the American Rescue Plan Act. Again, I'm Patty Morton, General Counsel at Maryland Nonprofits. We have closed captioning, a live transcription for those who wish it. We have live interactive session today, so you can communicate with the moderators for tech support. Use the Zoom chat feature. You all know this from our time already here today. We are hopeful that you will complete the session survey at the end of the program. And if you run into any issues, just use the chat to let us know what's going on. So without further ado, I give you Neil Bergsman, and thanks, Neil, for your time today.
Okay, thank you, Patty. Good morning, everyone. Oh, let's see. How about, no, I'm off mute. Okay. Patty's nodding. I think that means you can hear me. So we are going to talk about the ARPA update and other news about government funding. So we will try to put that slideshow up for you. Lovely. And if you do have questions that you want answered, please put them in the chat in Zoom. If you put your question in Wahoo, we will read it eventually, but not during the session. So if you have a question you want answered, I'll put it in the Zoom chat. Patty will be monitoring the chat because I'm not good enough to talk to you and read your chat at the same time. And if it's a question that we really need to address right away because I said something in a way that didn't make real sense, Patty will interrupt me and will clarify that. We have a few pauses for questions built in. So if it's a substantive question, she'll wait for a slide that has a big question mark on it, and we'll take it then. What we are going to do today, whoops, my little thing is circling. That's not good. Here we go. Okay, so we are going to briefly take a trip down coronavirus memory lane and remind you of what we've all been through over the last 18 months. And how the coronavirus and the lockdown have affected the nonprofit sector in Maryland. We will briefly remind us of the financial relief that has come from government to the economy generally and to nonprofits in particular so far. We are very excited and privileged. First of all, the Maryland Health Connection is a sponsor of our annual conference, so thank you very much. But equally important, we have a guest expert, Michelle Eberly, the executive director of the Maryland Health Connection, who will give you a break from hearing my voice for a moment and provide some very interesting news about how ARPA and other initiatives during the pandemic have affected our health coverage in Maryland, and that part is good news. Then we will get into the nuts and bolts about what is actually going on with the ARPA program and some of the potential programs that are coming down the tracks after ARPA. And then if we've left any time, we will have discussion and questions. So, what were you doing on March 5th, 2020? So you can just think about that question. You can answer in chat if you want. If you have your notebook in front of you, you can scribble down notes for yourself. March 5th, 2020. Can you remember that far back? We were all concerned about this this virus that started in Asia and was cropping up in Europe. I was astounded to hear on the radio that Italy had closed down the whole country because of this virus, and we weren't sure what was going to happen here, but we were worried in early March of 2020. Y'all remember where you were on or about that time? So March 5th was the day that Governor Hogan declared the state of emergency in Maryland. It was the day after the first confirmed positive cases, first 3 confirmed positive cases here. A week after that, we closed schools for 2 weeks and banned gatherings over 250. And if you remember, this was the time there was, a live press conference pretty much every day, usually outdoors in front of the governor's mansion with a sign language interpreter. This was seeing sign language interpreters at these presentations was a new thing for a lot of us, a very welcome change. And it seemed like every time the governor went on TV with one of these things, he was closing more things and making gatherings smaller and smaller. A few days later, bars, restaurants, gyms, movie theaters were closed. Gatherings went down to 50. I think they went down to 10 eventually. And then we had a stay-at-home order on March 30th, which was in place for months until May 13th. So that was our lockdown period. And I remember talking to my son in Chicago, and he said, "Dad, how long do you think this thing is going to last?" And I said, "Well, Lou, I think it's going to be longer than 2 weeks. I think it might be 6 weeks or 10 weeks." And I was quite the pessimist in those days. So far, 547,000 recorded cases here in Maryland as of last week. 49,000 hospitalizations, which peaked in this past January at over 1,900 in the hospitals that day. 10,664 deaths. I mean, every one of those deaths is a tragedy for that family and a disruption, and just a sadness. And 10,000 of them. I mean, when there's an accident on the highway and 6 people in a minivan die, we think that's awful. 10, the loss we've experienced is inexpressible. Unemployment increased 66,000 people in 1 month. Unemployment is still 19,000 people above the pre-pandemic levels. And we have had shortages. Do you remember this? Early on, personal protective equipment and tests and ventilators were short, and Lysol wipes and toilet paper, yeast. Remember, everyone wanted to bake sourdough bread. You couldn't find yeast in the grocery stores. Bicycles, exercise equipment, lumber, used cars, RVs. The list goes on. And on top of that, there have been echo effects, housing insecurity, including these problems with evictions, food insecurity, learning loss, mental addiction, a mental illness, addiction, suicide, the damage that has occurred because of the disease itself and the social stresses and the economic stresses in the lockdown are we have some statistics, but it's kind of incalculable. And it has not been equitable either. We are learning to look at everything through the equity lens. So on this chart, the bottom slice shows Black, Hispanic, and white shares of the population, and you can compare the number of vaccinations as a share of all vaccinations. So that looks pretty much pretty close. I mean, if we looked at this a few months ago, we would see white people having most of the vaccinations, but then, you know, once we got through April and May, and all the people who were eager to get vaccinated and had access to do so were able to, then we white people started losing ground on vaccinations because we thought that they went against our politics. So vaccinations were more unequal than they are now, but that's also because white people have the privilege not to be vaccinated. African Americans have had more than their share of deaths, and Latinos have had more than their share of cases, and white people have had fewer deaths and fewer cases than our share of the population. So, you know, some of the inequality in outcomes comes from genuine physiological factors, age, pre-existing health conditions, and stuff like that, but not most of it. Most of this inequality comes from systemic and social factors, the legacies of our stratified society, and a history of racism and oppression. And that affects, I'm not going to read all of my hexagons here, you can read them. Income, access to transportation, access to healthcare, ability to work remotely. So, you know, I'm a middle-class, white, suburban, college-educated guy. The pandemic and the lockdown were a pretty big inconvenience for me. But I had a salaried office job. I was able to work remotely and still am. I have a car. I could get to grocery stores and other places I needed to get. I have a regular physician. I am able to go to the hospital or an urgent care clinic if I need to. But people with lower income, minorities, and immigrants often don't have all of those advantages. And it's a big part of the reason why outcomes have been tougher, not just in terms of cases and deaths, but unemployment and housing and mental illness. It's been tough on everyone, but tougher on the disadvantaged segments of our society. So, what about the nonprofit sector? Okay, well, here again, what were you doing in May of 2020? So this is like 15 months ago. So May was the peak of the first wave in Maryland. We were getting 1,700 cases a day. We would get a second wave in July, and then the third and largest peak would arrive in December. And nonprofits were experiencing a lot of stress in this period. Just last week, the US Federal Reserve came out with a study that I urge you to look at when you get a chance. I urge myself to look at when I get a chance, because I've been busy preparing for this conference. So I've just read the executive summary so far. Among nonprofits serving children, 57% said that COVID-19 caused a significant disruption of services. 77% said last August, when this survey was being taken, that conditions are still worse than they were pre-pandemic. Half of those organizations said it will take 1 to 3 years before they return to pre-pandemic conditions. Almost 70% of the nonprofits in the survey said that demand for services increased compared to pre-pandemic. More than half said that the pandemic had a negative impact on their organization's finances. 60% said that in the current environment, they can operate for less than a year before they hit a financial crisis. Here in Maryland, we did our own survey several months ago. So, you know, we keep telling government officials and other decision makers that nonprofits are businesses with all the same pressures and losses that for-profit businesses experience. You are the frontline forces providing health, mental health, food, shelter, childcare, and so on, transportation. Nonprofits have had to cancel their big fundraising events, cancel programs for which they charge fees and earn income. And a lot of nonprofits have had to lay off staff because they aren't able to conduct their programs. So nonprofits have been affected by the coronavirus. Okay, so finally, June 29th, 2021. So right before the 4th of July holiday. You remember? It seemed like maybe we were over the worst of it. I was planning a couple little trips out of state. Venues were opening back up. Restaurants were opening back up with indoor seating at tables. So that was the trough prior to the Delta outbreak. That day, there were only 36 new cases in Maryland, and not 1,900. So the fifth wave peaks September 27th, just a few weeks ago at 1,567. And of course, that's all a result of the Delta variant and hesitancy about vaccines and a lot of hostility towards or tiredness, fatigue about masking and social distance and what have you. So you know, I gotta show you the graph. That's what Maryland's COVID cases look like, and you can see those waves. And our government responded with money.
Folks, Zoom has been strange today. Thanks for bearing with us.
Okay. So right as the pandemic was beginning, there was a federal action that provided some paid leave, payroll tax credits, some funding for unemployment insurance, and some emergency funding for personal protective equipment and other public health measures. Of course, you know, the money was great, but there was no personal protective equipment or tests available to buy, so was of limited help. Then very quickly, a couple of weeks later in March, we had the big CARES Act, Coronavirus Aid, Relief, and Economic Security Package, and that include the Paycheck Protection Program, which was enormously helpful to a lot of nonprofits. Maryland nonprofits, our sister state organizations, and the National Council of Nonprofits were instrumental in getting Congress to include nonprofits in some of these programs, and extended unemployment benefits, and the first chunk of state and local government fiscal relief. There was another act at the end of the calendar year in December that mostly extended some of the CARES Act provisions, because again, no one knew how long the pandemic and the lockdown were going to take, so they would have expired at the end of the calendar year without congressional action. The state, at the end of the 2020 session, provided some funding to address the emergency, and it included some funds that specifically or predominantly help nonprofits. $20 million for nonprofit assistance that was managed through the Department of Housing and Community Development, aid for arts and entertainment, and TDAP and utility, a dedicated funding for the big food banks, and then other programs that helped individuals, which were probably customers and clients of nonprofit services. So we like that. Bottom line, it's working mostly. So there was an economic collapse right in March and April when the pandemic broke. Because of this government aid, the economy writ large rebounded. Now, that doesn't mean it rebounded for everyone, but we avoided a prolonged recession. We had a sharp and quick recovery. So what economists call a V-shaped recovery. We got vaccines developed and delivered in record time. It's really a public health miracle what we've been able to do with the vaccines. And as of today, transmission, hospitalizations, and fatalities all appear to be trending down. Of course, as we've seen, that's happened 3 or 4 times before. It's been far from perfect. In fact, there have been significant problems. The rollouts of testing and vaccination have been uneven and chaotic. There have been significant racial, ethnic, and class inequities in the delivery of services and relief. As we've seen, there's been widespread resistance to public health measures, not just in the white community, but we have fewer good excuses than anyone else. Really severe workforce disruptions. There have been some administrative disasters in getting the unemployment assistance and the rental assistance and some other programs out. And of course, what a lot of people are focused on now are the supply chain disruptions. So, a lot of stuff went wrong. A lot of stuff perpetuated pre-existing dysfunctions and inequities. But overall, this has been one of the better government responses to a crisis that we've seen in the last generation or two. So, Patty, any questions so far that we should address?
I was just going to ask you if you had a question break coming up, Neil, because we do have a question in the chat that I think is timely, and I'll share it with you here. Do you have recommendations for the ask amount for ARPA request in Baltimore City for nonprofit organizations, and over what period of time? For an example, a percentage of budget or the percentage of lost revenue? What would you recommend?
Please call or email me after the conference. I want to talk about your specific circumstance. My advice is always ask for what you think you need. Budget offices are very good at making numbers smaller, not very good at making numbers bigger. And Bergsman's law of the budget states that if you ask for something, you might not get it. If you don't ask for something, you won't get it.
I'm going to put your email address in the chat, Neil, for folks. Is there a difference for Baltimore City organizations compared to organizations across the state or elsewhere?
Well, so there, as we'll see in a minute, there's money coming from the state and there's money coming from each local government. Baltimore City is looking to partner with nonprofit organizations. They have a preference for nonprofit organizations with a track record and that they can give relatively large grants or contracts to, over $500,000. Across the state, it really varies jurisdiction by jurisdiction. And we have gone and spoken at the Association of Counties and the Municipal League. We're going to be in the next couple of weeks promulgating to them a nonprofit friendly model grant program that we think they can use that will be helpful to you if they do. But you really need to be in touch with your county and municipal officials, and the lay of the land is a little bit different in every jurisdiction.
Neil, we have a question. Not sure if you'll cover this later, but has anybody started receiving ERTC funds yet? There's an understanding that they're very delayed.
Yeah, I am not going to be covering that, and I don't know the answer. So Patty, if you'll put that in the parking lot to me, I will follow up and respond when I have a chance.
Okay, I'll invite our guest to email you. Your email address is in the chat, and you can have a conversation offline. No other questions waiting in the chat?
Okay, so next we are going to talk about
one more. Sorry, I'm sorry, Neil. I apologize. Yep. Can a nonprofit get any help that's not related to payroll? We don't have paid employees.
Yes. So we will be talking about this further. So when I get to the slide that has the target with the bow and arrows in it, if I don't answer your question, please ask again.
Thank you.
Okay, so is Michelle here?
I am here, yeah.
Okay, so let me introduce you. Again, we want to thank you and Maryland Health Connection for being a sponsor of our annual conference. We're going to talk about some of the things other than state and local fiscal relief that have come to Maryland and to the nonprofit sector through Arpa and other government programs. And one of the most important things is access to health care. So we have Michelle Eberly, who is Executive Director of the Maryland Health Connection, which is also known as the Maryland Health Benefits Exchange. Michelle came to the state in 2013 as Executive Director for the Maryland Health Insurance Plan, which was our pre-Obamacare high-risk pool. She came to the Maryland Health Benefits as Director of Plan Management and Chief Operating Officer, and is now Executive Director. She has 32 years of experience, having held various roles in insurance, healthcare, and information technology, and is a proud graduate of Nazareth College in Rochester, New York, and Southern New Hampshire University, and she's my neighbor here in Annapolis.
Thank you, Neil, very much. It is my pleasure on behalf of Maryland Health Benefit Exchange to be sponsoring this conference, and personally having served as the executive director for a nonprofit domestic violence agency. It is very near and dear to my heart, the nonprofit world. So I'm pleased to be here. I want to talk to you just a little bit about some of the things that have happened with health care and health coverage since COVID and with the ARPA funds. So when Governor declared a public health emergency, the exchange immediately opened up a special enrollment period. In private commercial health insurance, as you probably know, you're restricted to applying for coverage for a certain time of the year, unless, of course, there's some life event. Well, we put in a special enrollment period, and we ended up in the nation having the longest special enrollment period in the nation from March 15th, 2020, right through August 15th, 2021. During that time, we covered, provide health insurance cover for well over 100,000 new people. And that was in Medicaid and private commercial insurance. One of the things that's really important for you as a nonprofit organization, particularly if you're a small nonprofit organization, is to understand that there's really good, affordable health coverage through the exchange for individuals. And in fact, through Arpa, there are now enhanced tax credits, and they are so enhanced and so good that we have many comprehensive healthcare policies that are available for under $10 a month, particularly for young individuals. And on the state level, we've even added a new subsidy for young adults age 18 to 40. I think it goes right up to 40. And again, in the nonprofit world, if your organizations are anything like mine, we have an awful lot of young folks and young families that were looking for health coverage, and there is affordable health coverage available. So I want to leave that message with you all. And also we worked with Department of Labor for folks that were unemployed to get health insurance. We did another special enrollment if you're uninsured. And it just has been hugely successful. Another critical component of ARPA was that it now allows for tax credits for individuals who make over 400% of the federal poverty level. And that's about $100,000, I believe, for a family of 4. So it's really important to, if you think you weren't eligible for any tax credits before, to come back and look, because health insurance in Maryland has become very affordable. And again, as I said, especially in the nonprofit world, we are always looking for ways to provide value add and benefits to our employees. And that's a way you can direct them to get very comprehensive coverage. So I'm going to leave it there today. I know I have just a brief period of time and enough time to give Neil a break from speaking, but I will let you know that I am coming to your membership meeting on November 4th, and we'll have more time there to talk. So if there's anything particular you'd like me to address at that meeting, please get word back to me, and I'll make sure that we are prepared, and I'm prepared to present to you on whatever topics you're most interested in. Have a wonderful time with the rest of this very valuable conference. And again, we're delighted to sponsor, and thank you for the invitation to speak.
Neil, you're on mute.
Okay, there we go. So so I was going to say that. So if you are a member of Maryland Nonprofits, you can hear more at our regular member meeting on November 4th. And if you are not a member of Maryland Nonprofits, why the heck not? Join up, please. Okay, so let's move on to ARPA itself. So $6.4 billion, just under part of ARPA, the part that goes through state and local government. And that is working its way through the system. Now, people come to me and say, how can my nonprofit get some of this ARPA money? And I want to be able to tell you, well, here's the spigot. Take your bucket to the spigot. Here's how to turn it on. And when your bucket's full, turn it off and save it for the next person. But ARPA isn't working that way. It's not one spigot that's open at one time that you can turn on and turn off. It's going through a dozen different state agencies, 24 counties, 150 municipalities, and each organization, each jurisdiction, each agency is able to set up its own priorities and its own process. So really, we can provide you a lot of help about what's going on in the state level. And we're trying to keep up with the counties and municipalities, but it's frankly impossible to difficult. And so we really urge you to be in touch with your own local officials, particularly if you have someone in your local government who is a good champion for you. The American Rescue Act was $2 trillion nationally. It did set up another wave of paycheck protection. The disaster loan continued enhanced unemployment insurance, provided $1,400 per person direct assistance payments to anyone who had filed a tax return. And there was this state and local fiscal relief fund. And so that's what I'm going to be mostly talking about: state and local coronavirus state and local fiscal relief funds, which we pronounce SISLRIF. SISLRIF has 5 eligible uses. You can address the health effects of COVID. You can address the economic effects of the pandemic. Governments can provide premium pay for essential workers. Governments can restore funding that they lost as a result of the pandemic. And governments can use it for capital projects in water, sewer, and broadband. So,
Neil, is this the slide with the target where you're going to welcome questions again? I have one that came in through the Whova chat.
Yes, this is the one where I was going to talk about what you can do besides employment related stuff. So read me the question. I'll make sure I hit it when I get to that point.
It is related, I think, and it is whether the ARPA grants are for reimbursing funds that are already expended, or are they awarded outright? And so I'm sure you'll fill that into what
so that is a great question. The ARPA funds have to address expenses that were incurred after March 3rd of 2021. So you can't go back and recoup costs that you incurred in 2020 or in January or February of this year, except for that premium pay provision. That's an exception. I'll get to that in a moment. So if your question is really, if I successfully apply for a grant from my local government or the state, is that going to be on a reimbursement basis? That is between you and the granting agency. We are encouraging governments to consider paying upfront or making progress payments as opposed to paying strictly on a reimbursable basis. But the federal government doesn't tell the state and local governments how to do it. And they are allowed to pay upfront or on a progress basis if they choose to do so.
Neil, we have a couple related questions in that same vein. Are there limitations on ARPA for new nonprofits, and are the funds only for reimbursement or new programming that addresses negative impacts from COVID?
Yeah. So, okay. So let me deal with the second one first. So I think when Congress passed this, they were thinking of pretty direct health and economic effects. They were thinking of the cost of personal protective equipment or running testing or vaccine operations, or they were thinking of reimbursing, providing aid for like restaurants and entertainment venues that were directly affected economically by the lockdown. But the Treasury guidance has told us to think more broadly, especially when we're doing work in disadvantaged areas or with disadvantaged populations. So we can think about the societal factors that make a community vulnerable to COVID, and we can address those. We can think about the economic factors that will help a community recover from COVID, which might be childcare, which might be job readiness, and address those if you are serving a location or a population that has been disproportionately affected by the pandemic. The US Treasury is telling us to think pretty broadly, and if we can draw a line of logic between the disease or the lockdown and the thing we want to pay for, there's a good chance it's eligible. Now, again, this is still, going through 24 counties, 150 municipalities, and a handful of state agencies. So, you still have to apply for those funds and convince that granting agency that your proposal is one of the best. Premium pay for essential workers. I think this is a huge opportunity for us in the nonprofit sector. So far, this provision has been used almost entirely for government employees, providing premium pay for bus drivers and teachers and sanitation workers and clinic workers and so on. However, the Treasury Department allows it to be used for third-party providers who are essential employees who have to deal directly with members of the public that could expose them to the virus. So I think it is absolutely the case that nonprofits providing human services should make a case that you need some of this money. You are in a staffing crisis. Your employees were underpaid before COVID, and now they've had to take on greater responsibilities, greater risks, greater inconvenience, and they deserve a share of this pay. So I think this premium pay use is something that we need to press hard on nonprofit human service providers getting some of this. And, as we know, the direct care human services workforce is predominantly female and disproportionately minority. So there's also a big equity factor to trying to convert this two-pointer. I'll try not to use any more sports analogies, sorry. The government revenue losses usually isn't something we can hang our hats on, except that if a government is using ARPA money for revenue loss, they can spend it on anything. So if you have something that is not strongly related to the virus and the lockdown, there's still a chance you could get a piece of government funding if your government is taking advantage of the revenue loss provision. And then water and sewer projects are obviously not something that a lot of nonprofits build, but broadband is a huge issue. And while a lot of this money is going to go to broadband providers to increase service, a lot of it is also going to go to individuals and households to provide subsidies for monthly service costs and to provide devices like Chromebooks so that people can use the broadband that's becoming available in their area. Doing the outreach and the awareness and working with our local governments to make sure that they target the people most in need effectively is a big role for nonprofits. And we've been in contact. Well, if you go to the DHCD conference session tomorrow, you will hear about the statewide broadband offices plans to work with local governments, local communities, and nonprofits to be able to target this outreach and to be able to get the benefits to the people who need them. Okay, Patty, any more questions I should cover on this slide?
We have a collection of questions, but I'm wondering, I know you have a lot of material to cover, and I'm hoping that folks will just exercise some patience, let you get through.
Okay, so
more
let's see.
info.
Yeah. So this was the important one. Everything else is really meaty, and you'll want to hear it. But whenever we hit 2:45, we'll stop, and it'll be good. So this is the big thing I want you to know, and I want you to communicate when you talk to public officials, when you talk to citizens in the community, when you talk to journalists, when you talk to people who say, what does federal funding have to do with nonprofits? Congress and the Treasury Department have specifically made nonprofit organizations and nonprofit services an eligible use of state and local ARPA funds. We are in there. We are in the law. We have a seat at this table. We have a piece of this pie. So here in Maryland, the 2021 legislature made a deal with the Hogan administration about how to use the ARPA funds. A lot of it went to restore the Unemployment Insurance Trust Fund, which is going to be important for nonprofit employers because it means that our tax rate isn't going to go way up. And you can read where it went. So, you know, there are a lot of things here that affect nonprofit clients and customers, you know, including public assistance, apprenticeship and training, nursing home rates, utility bills. Not all of this money is, I mean, it's all allocated to categories. It's not all allocated to specific contracts or grants. So specifically in areas like apprenticeship and training, community outreach in the broadband access, school reopening, there may be jobs for nonprofits to do in these areas that you can get a chunk of this money. And people always ask me about the timeline. The money has to be committed by 2024 and expended by 2026. Some of this money may come back. They may find that they're not able to use it all for the original purpose. And so it may get recycled and there may be new opportunities for that. There's only about $50 million in the state fund that as of today is completely unallocated. And you should definitely write to the governor's office and you should talk to your local legislators if you have a good idea of how your organization can use some of that $50 million. A lot of the counties and municipalities are not nearly so far along in deciding their money. So I think right now there is more money up for grabs at the county and municipal level than there is at the state level. But, you know, I think you got to push forward on all fronts. So as I was saying, some of the state programs are not fully spec'd out. There's a lot of local government funds and there's funding that might become available. At the state level, we don't have a real formal process. It's loosey-goosey. People are writing to the governor's office and saying, I would like some ARPA money for blah, blah, blah. They get those letters, they make a spreadsheet. At some point, the governor and the budget secretary and their teams are going to sit down and decide what gets funded from that list. So you want to get your letter in so you can be on that list. But it's not just about getting our bucket under the spigot to get dollars. Advocacy is at least equally important because we owe it to our members, clients, stakeholders, customers, constituencies, to advocate on behalf of our organization's missions. And so we should be in touch with the head of the state agency that runs the programs where in the policy areas we operate. We should be in touch with our state legislators and our local officials, and we should be looking to make sure that they are focused on equity in the allocation and administration of these funds. And with all the considerations that Naya went through so much more charismatically than I can, you should be banging on doors to make sure that you and the communities you represent are involved in this planning and decision making. We need to think broadly about health effects and economic effects, not just about getting shots in arms, that's important, but also, thinking about access to care, transportation, primary and preventive care in the future, all the things that have made our health outcomes in 2020 and 2021 inequitable. In our advocacy, we should sell the strengths of the nonprofit sector, that we are nimble, responsive, we know community needs, and we have the trust of the people in the community. We should be concerned about sustainability because this is one-time money. And we ought to be worried about if we start something now, what's going to happen when the money runs out. But we should not be paralyzed by that worry. So if we have a good idea, let's start it. And you know what? If it's successful, if it's popular, if it provides tangible benefits, we and our governments and our citizens will figure out how to keep it going. And you should coordinate with other groups that are doing good work in your policy areas or work that complements your area, and of course, with your humble statewide nonprofits association. There's another big piece of this called the Capital Fund. Maryland is expected to receive about $170 million from this. 100 of this has been already dedicated to broadband, and the other 71 million is up for grabs. This is restricted to broadband and to capital projects that relate to education, health, and workforce development. So it's kind of restrictive, but if you think you have a capital investment like a building that might be a good candidate, please find my email in the chat, and I'd like to talk about it. So, as we said, there are other pieces of ARPA besides the state and local CISLRIF funds, and some of those may relate to the programs that your nonprofit is involved with, especially in mental health and housing. Give you a moment to scan that. Okay, how are we doing on questions now?
Well, we have several, and you just referenced mental health, so I'm going to go back to a chat question pretty far up in the chat, which relates to mental health impacts of COVID and whether ARPA funds can be used to address those mental health impacts.
Yes, absolutely. It would be a great use of ARPA funds.
Okay, super. Thank you. And that's a nice, clear answer. Second question, can ARPA funds be used for hub zones or opportunity zones?
Certainly if you're operating in a qualified census tract or another, or in some other way serving a disadvantaged population.
Thank you. One of our participants, as I was told by city council members, that ARPA funds had to be used for infrastructure improvements. Is that a local decision or a rule?
That is not a rule.
Okay, thank you. Has the government extended the sick leave salary support for employers to cover salaries of staff if they or their families get sick with COVID?
Again, I'd like an email on that so I can follow up. That is not a particular weed I've gotten into yet.
Thank you. Thanks. Let's see. Coming up on our next. Neil, do you have any recommendations for how to send an effective message to the governor to get on the list? And if so, your listeners would like to hear those tips.
Okay. The letter should be short. The first paragraph should say how much money you're asking for, what it's for, and what the benefits are. The second paragraph should say how that's related to the COVID pandemic or its economic effects. And you can include supplementary material with more details if you have it.
Neil, can you go back a slide? Can you just
say something complimentary about the governor?
Great.
These are all things I don't know as much about, except that they're there.
Is there an email address that can be used to send this message to the governor's office?
So what it's hard to send an email directly to the governor. So we recommend you send a paper copy to the governor through the mail and send email attachments to the governor's chief of staff, to the budget secretary, and to the secretaries of the state agencies that deal with your policy area.
Okay.
Wait a second. I want to do one more slide before we run out of time, though.
Thanks.
So there's a bunch of other exciting stuff coming down the track. Congress is having a lot of trouble deciding itself, and it has scheduled a train wreck for December. That train wreck will involve continuing appropriations for the federal government, extending the debt limit so that the government can pay its bills, passing the bipartisan infrastructure bill, passing some scaled down version of the president's Build Back Better initiative, and completing the overall budget reconciliation. All of those things come due on or about December 3rd, and it's going to be a cliffhanger. It's 2:45.
Can we fit in one last question, Neil? And
I don't know. I'm only the presenter. I'm not in charge of the clock.
Well, let's push and see what we can do.
Okay.
It's fine. The Zoom room's going to stay open for another 15 minutes till the next session. So go ahead.
Last question. Maryland has a $2.5 billion budget surplus this year. Governor Hogan said that he wants to return the money by tax cut to the Maryland population. Since the budget surplus has a component from recovery funds, won't this dry up the available recovery funds for Maryland?
Okay. So the state closed last year with a $2.5 billion surplus. So that's like the checking account balance. So we expected to have some of that. So that's 1.7 billion, only 1.7 billion better than expected. I say that ironically. 1.7 billion is still an awful lot of money. On top of that, as the state looks forward to its next budget, the revenue is doing better than expected. So overall, the state is expecting to have $4 billion more for the current budget and the next budget than what we would have expected when the legislature left town, having passed a budget last spring. Governor Hogan has gotten out in front of this issue very adroitly, very cleverly, and said that he wants to use the surplus for increasing the rainy day fund. And that's a pretty good idea because it means we won't have abrupt mid-year cuts the next time we have a revenue shortfall, as surely we will sometime in the future. Tax cuts for retirees, tax cuts for working families, relief for underserved Marylanders, and enhancements for state employees. So I think our job as budget advocates is to get that relief for underserved Marylanders slice of the pie as big as we can get it. And I'll suggest that a lot of it be used in services and benefits for people who have not been helped by the recovering economy, who are in bad shape right now, and for investments in things like job training and readiness and primary and preventive care and education and mental health, including bilingual mental health services, Gabriella, that will help us the next time we run into trouble and help us to prosper equitably in the coming era of abundance. The governor does not have the final say in how the surplus gets allocated, but he does have a very powerful role, and the legislature cannot directly add expenditure items to his proposed budget this year.
Is that a logical breaking point, Neil?
I think so. I think so. And please, I can talk about this stuff for hours and hours. So please send me an email or message me through the Wahoo if you want to talk about any of this some more. The PowerPoint will be available to you, so you can see the handful of slides that we didn't get to.
So I'm going to post your email address again for folks. Oh, thank you, Heather. And I will remind folks to please complete a survey at your convenience if you can, so we can present you even better in the future. And thank you all for being here, and we'll look forward to having you join us at the next segment.
And up next is going to be the Getting Ready for Growth with the Standards for Excellence. And that will start in about 15 minutes.